Hi, I'm Lily from the Public Health Youth Association of Canada, and I'm here to teach you how to handle the infodemic. Mass media and social networks have always played a fundamental role in the management of health-related information. As stated by the WHO, the COVID-19 outbreak and response has been accompanied by a massive infodemic, an overabundance of information, some accurate and some not, that makes it hard for people to find trustworthy sources and reliable guidance when they need it. Infodemic refers to a large increase in the volume of information associated with a specific topic and whose growth can occur exponentially in a short period of time due to a specific incident, such as the current pandemic. People were continually searching for information regarding COVID-19 as it was a novel disease to them. They became overwhelmed with news containing fake reports and misinformation, which can be complicated to digest without the right skills. Just around 361 million videos were uploaded on YouTube under the COVID-19 and COVID-19 classification. Just in the month of March 2019, over 500 million tweets included the terms coronavirus, COVID-19, and pandemic. About 19,200 articles have been published in Google Scholar since the pandemic started. Inaccurate and false information has been circulating about all aspects of the disease, how the virus originated, its cause, its treatment, and its mechanism. Misinformation can circulate and be absorbed very quickly, changing people's behavior and potentially leading them to take greater risks. Misinformation makes the pandemic much more severe, harming more people and jeopardizing the reach and sustainability of the global health system. It's important to note the differences in forms of false information that you may come across. The four forms of false information include misinformation, disinformation, malinformation, and fake news. Misinformation is false information that is spread without the intent of being harmful. Disinformation is false information that is spread deliberately to be harmful. Malinformation is information that may be true but is used to harm a person, organization, or country. Fake news is information that is misleading or fabricated information that mimics the form of mainstream media. Now that we've learned all four forms of false information, we want to know, how have Canadians interacted with misinformation during COVID-19? The Canadian Perspectives survey series done by Statistics Canada showed that 9 in 10 Canadians used online sources to find information about COVID-19. The three main sources were online newspapers or news sites, social media posts from news organizations or magazines, and social media posts from other users or influencers. During the first few months of this health crisis, 96% of Canadians who used the internet to find information saw COVID-19 information that they suspected was misleading, false, or inaccurate. Nearly 40% of Canadians reported believing that the information they saw related to COVID-19 was true, and then later realized that it wasn't. Many Canadians were not in a regular habit of checking the accuracy of information they found online, with only 21% reporting they always check the accuracy and 37% saying they often check. All of this facilitates the sharing of potentially misleading, false, or inaccurate information. So we want to know, how does the infodemic make the COVID-19 pandemic worse? Well, first of all, anybody can write or publish anything on the web, in particular on social media channels, whether it is individual or institutional accounts. There's no quality control on what's published and sometimes on what's used to take action and make decisions. This makes it hard for people, decision makers, and health workers to find trustworthy sources and reliable guidance when they need it. Sources can be anything from apps, scientific organizations, websites, blogs, influencers, and more. So now that we've learned what misinformation is and the danger behind misinformation, let's learn how we can deal with it. To counter misinformation, the public and policymakers need to rely on healthy, resilient information environments. That means public institutions, online platforms, and internet users all have a role to play in reducing the impacts of misinformation. The Organization for Economic Cooperation and Development has identified 3 pillars in combating misinformation: the importance of public institutions having transparent strategic communications, the role of online platforms as relevant players that are able to limit the spread of false claims, and lastly, education to equip future generations with appropriate digital and media literacy skills. So here are the steps that you can take to avoid misinformation. Number 1 is check the credentials. Is the author specialized in the field that the article is concerned with? You want to make sure that the author can speak about the subject with accuracy and authority. Number 2 is look for bias. Does the article seem to lean toward a particular point of view? Does it link to sites, files, or images that seem to skew left or right? Biased articles may not give you the entire story. Number 3 is check the sources. If the article cites sources, it's good to check them out. Sometimes official-sounding organizations may represent only a fringe view of a group of people. Number 4 is check the dates. Try to find the most up-to-date information as information changes on a daily, especially for COVID-19 related information. Last but not least is be alert and judge hard. If what you're reading sounds too weird or too good to be true, exercise caution when taking information. To help you further, I've put together a list of reliable sources that you can use to avoid misinformation. Some of the reliable sources that you should use to stay informed about the pandemic include the Centers for Disease Control and Prevention, the Government of Canada, the National Institutes of Health, and the World Health Organization. And that brings us to the end of this video. I hope you learned something about the infodemic, and if you ever want to find out more on this important topic, feel free to visit the websites I've included at the end of this video, as well as reach out to us at Public Health Youth Association of Canada. I'd love to chat with you. Bye for now!